Hi, I'm Jean Marie, and I'm going to talk about gut instincts. Can the Mediterranean diet be a delicious cure for lupus? Lupus is an autoimmune disease with high inflammatory markers like cytokines and interleukins, and it is characterized by symptoms like the butterfly rash, fatigue, hair loss, mouth sores, and patients can get flares, which is an increase of these symptoms for a period of time. Some patients can develop nephritis, and in the US, 72 to 73 people out of 100,000 have lupus. And the prevalence in females is 9 times higher than in males. When we're talking about treatment, the go-to is hydroxychloroquine, which is an anti-malarian drug, and it can be complemented with corticosteroids. And if the patient does not respond, they can be given stronger medications and even biologicals, which are injectables, but these medications have a higher and stronger side effects. So, what about diet? Can diet actually be included in the treatment? And that brings us to our bottom line up front. Given that diet modulates the gut microbiome, can a Mediterranean diet improve gut microbiota dysbiosis and have positive implications for lupus? I am a female in my 30s that has lupus. I take hydroxychloroquine and sometimes complement it with prednisone. I get frequent flares, especially fatigue, and I have mild to moderate joint pain. And sometimes I do have high inflammation markers. So I'm thinking, what can I do to decrease these inflammation markers to decrease my frequent flares and decrease my pain? Now, the first study that actually looked at the gut microbiome in lupus patients was in 2014. And they studied 20 patients and they did a 16S ribosomal RNA gene-based analysis. But we know from our class that it can have limitations when differentiating genus. The second paper I will be using is a review from 2024, and it does a good job summarizing many studies done in lupus patients throughout the years. What all these studies have found is that there is an increase in bacteria associated with inflammatory markers and a decrease in bacteria that are considered to be good bacteria. So these bacteria decrease inflammation, contribute with energy, which I struggle a lot, and nutrient provision. They also saw a decrease in the alpha and beta diversity. So when we look at the gut microbiota in people that follow a diet high in preservatives, high in sugars, and high in purines, proteins, which can be a problem with patients that have nephritis, studies have shown that there is a decrease in good bacteria and an increase in some bacteria that may promote inflammation and a decrease in biodiversity. But people that follow a med diet, which is rich in legumes, olive oil, fish, vegetables, they see an increase in the good bacteria and a decrease in bacteria that may contribute to inflammation. And they also see an increase in the alpha and beta diversity. So we know that lupus patients have a gut microbiota dysbiosis that promotes inflammation. We know that diet influences the gut microbiome, and specifically the med diet can increase the good bacteria in the gut. So we are seeing that the med diet can improve the gut microbiota dysbiosis and help lupus patients. So as a lupus patient that takes her medication, I thinking about my gut microbiome and I should be considering, and I will be considering my diet as part of my treatment and follow a med diet to increase the bacterial diversity and good bacteria and have a healthier gut microbiome that will actually have or promote a decrease in the inflammatory markers and help with my flares and pain. So, do you think other lupus patients would find this approach feasible? How easy do you think it would be to change your diet to a Mediterranean diet? So, I look forward to your comments. Thank you. And these are my references.